Do you feel lower back pain when you stand up, bend down, or wake up in the morning? The good news is you don't need intense workouts or hours of exercise to improve it. Just 5 minutes a day of gentle movements can help your spine relax, reduce muscle tension, and restore flexibility to your lower back. The exercises in this video are specially designed for people over 60. They focus on relieving pressure in the lower back and pelvic joints, activating the muscles that support the spine, and improving posture. The movements are slow, safe, and easy to do right at home. With daily practice, you may notice your back feels lighter, less stiff, and much easier to move. Start taking care of your back today. Have you ever noticed that sometimes just a small change in posture can make your back feel much better? Many people over 60 say that in the morning when they first wake up, or after sitting for a long time, their lower back feels stiff and heavy. That feeling can make simple things, like bending down to put on shoes, standing up from a chair, or turning your body, feel slower and more difficult. Interestingly, the spine isn't always becoming weaker. Often, it has simply become used to moving less or staying in one position for too long. When we spend many years sitting, watching TV, reading, or resting in a chair, the spine often starts to lean slightly forward. Over time, this posture can reduce the natural curve of the lower back, and the small joints between the spine and pelvis may become stiffer. As a result, when you stand up or begin to move, your back may send signals of discomfort, such as a dull ache, tightness, or heaviness. This is very common, and many older adults experience the same thing. You are not alone. The good news is that very gentle movements can help the spine remember how to move more comfortably again. One simple exercise often recommended by physical therapists is the prone elbow press, where you lift your upper body using your elbows. This movement allows the lower back to open naturally and helps reduce the pressure that builds up when we sit or bend forward for long periods. Many people notice a sense of relief after holding the position for just a few seconds. One of the biggest benefits of this exercise is that it doesn't require special strength or flexibility. You simply lie down and allow the spine to stretch in a gentle, natural way. When practiced regularly, this movement may help reduce morning stiffness, improve posture, and make standing or walking feel more comfortable. Some people even say their hips and lower back feel more relaxed after doing it. If you'd like to try it, move slowly and gently. First, find a flat and fairly firm surface such as an exercise mat, a firm mattress, or a carpeted floor. Lie face down and rest your forehead on your hands. Take a few slow breaths to relax your body. Then gently place your elbows on the floor and slowly lift your chest slightly. You don't need to lift very high, just enough to feel a gentle, comfortable curve in your lower back. The most important thing is to keep your hips and pelvis in contact with the floor. Hold the position for about ** 20 to 30 seconds, breathing slowly and evenly. If you feel a mild stretch in the lower back, that is usually a normal response. However, if you feel sharp pain or strong discomfort, simply lower your body a little to find a more comfortable position. After holding the stretch, slowly lower yourself down and rest for a few seconds before repeating. With just one small movement for a few minutes, you are helping your spine move in a gentler and safer way. Sometimes, simple movements like this are the first step toward helping your back feel lighter and more comfortable every day. Have you ever noticed that sometimes just a gentle turn in bed can make your back feel a little better? Many people over 60 notice this in the morning or before going to sleep. When the body moves slowly from side to side, the lower back often feels less tight. That's not a coincidence. Our spine is designed to move in many directions, especially through gentle rotational movements. Over time, however, habits like sitting for long periods, moving less, or staying in one position for hours can make the spine feel stiffer. This often happens in the lower back and around the sacroiliac joints. When the small joints in the spine stop moving regularly, The body tends to protect the area by tightening the surrounding muscles. That tension can create a dull ache, discomfort, or a heavy feeling in the lower back after sitting for a long time or when first waking up. Many older adults say they become hesitant to twist or move too much because they're afraid it might cause more pain. That concern is completely understandable. But in reality, slow and controlled movements can help the spine gradually become comfortable with moving again, which may reduce stiffness and heaviness in the lower back. One gentle exercise often used in physical therapy is called supine knee rotations. This is a simple movement that can create a very relaxing feeling in the lower back. As the knees move slowly from side to side, the spine gently rotates, helping the small joints between the vertebrae begin moving again. At the same time, the muscles around the back are lightly stretched, which can reduce built-up tension from the day. What makes this exercise especially suitable for people over 60 is that it doesn't require strength or special flexibility. You simply allow your body to move gently with your breathing. Many people say that after a few repetitions, their lower back feels less tight, their hips feel looser, and their body feels more relaxed before sleep. If you'd like to try it, start slowly and gently. First, lie on your back on a flat and comfortable surface, such as an exercise mat or a fairly firm mattress. Bend your knees so your feet rest on the floor. Then open your arms out to the sides to help your body stay balanced and keep your shoulders relaxed. Next, slowly let both knees tilt to one side. There's no need to force them down or push too far. Simply allow gravity to guide your knees to a point where your back still feels comfortable. Hold for a few seconds. Then gently bring your knees back to the center. From there, slowly tilt them toward the other side. Think of the movement like a slow, gentle pendulum, swinging softly from side to side. At the same time, breathe deeply and evenly. You can continue this motion for about ** 30 to 60 seconds, or longer if it feels comfortable. Small movements like this can sometimes bring surprising relief. You don't need to move fast or with force. Just be patient and listen to your body. For many people, this gentle exercise becomes a simple way to help the spine feel more flexible and reduce that stiff feeling in the lower back after a long day. Have you ever wondered why your lower back sometimes hurts even when you haven't done any heavy work? Many people over 60 say they only walk around, do light daily activities, and still feel their back becoming tired, weak, or slightly painful when standing for a while. This often leads people to believe their spine has simply aged or is no longer as strong as it once was. But in many cases, the issue isn't the spine itself, it's the small muscles that help stabilize the back. Over time, when the body moves less or only within familiar routines, some of the deep muscles around the spine, especially those responsible for stabilizing the trunk, may become less active. When these muscles don't provide enough support, the larger back muscles have to work harder to keep the body stable. As a result, the lower back can become tired more quickly, feel tight, or sometimes feel weak when standing up, turning, or carrying light objects. Many older adults feel concerned when they hear about strengthening exercises. They worry that exercise might make their back pain worse. That concern is completely understandable. However, there are very gentle and safe exercises designed specifically to help the body reactivate the muscles that support the spine without putting heavy pressure on the back. One of these exercises is called the bird dog *, lifting the opposite arm and knee. This movement is commonly used in physical therapy because it helps the body learn to maintain balance and stabilize the spine while moving gently. When done correctly, it activates the deep muscles around the back, helping the spine stay more supported during everyday activities like standing, walking, or turning. When people first try this exercise, they may notice a slight shaking in the body or find it a bit difficult to maintain balance for the first few seconds. This is completely normal. It's often a sign that the stabilizing muscles around the spine are beginning to work again after not being used much for a long time. With regular practice, the body usually becomes more stable, and the back may feel less tired during movement. If you'd like to try this exercise, start slowly and gently. First, place both hands and both knees on the floor, similar to a tabletop position. Your hands should be directly under your shoulders, and your knees under your hips. Keep your back in a natural position, not sagging too much and not rounding upward. From this position, gently lift one knee about *1 to 2 centimeters off the floor, just slightly. Then slowly extend the opposite arm forward. For example, if you lift your left knee, extend your right arm. Try to keep your body stable and avoid rotating your hips too much. Hold the position for *3 to 5 seconds. Then slowly lower your arm and knee back down. Repeat the same movement on the other side. You can perform *6 to 8 repetitions on each side, moving slowly and breathing steadily. There's no need to lift high or hold for too long. The most important thing is to keep the movement gentle and controlled. Sometimes simple exercises like this can bring a renewed sense of confidence in movement. Just a few minutes a day can help your body gradually adapt and support the spine more effectively. And for many people, that small daily step makes the back feel stronger, steadier, and more comfortable in everyday life. Have you ever noticed that sometimes just a small change in posture can significantly reduce the heavy feeling in your lower back? Many people over 60 say that after lying down for a short rest or gently turning their body, the lower back suddenly feels more comfortable. This often makes people wonder if there is a kind of balance point in the body, where once it's adjusted, the back can relax and feel lighter. In reality, the pelvis plays a very important role in supporting the lower back. It acts as the bridge between the spine and the lower part of the body. When the pelvis stays well balanced, the spine usually functions more comfortably and efficiently. But over time, habits like sitting for long periods, moving less, or using one side of the body more than the other can cause the pelvis to become slightly unbalanced. When that happens, the muscles around the lower back often have to work harder to keep the body stable, which can lead to tension or a dull ache. Many older adults describe this feeling as a constant mild pressure or fatigue in the lower back, especially when standing up after sitting for a long time or when starting to walk. This is completely understandable and quite common. Our bodies go through many years of activity and adaptation, so sometimes they just need a little gentle movement to help guide them back toward a natural balance. One simple exercise often used to support this area is called a pelvic reset. This movement doesn't require strength or special flexibility. Instead, it uses very small motions to activate the muscles around the pelvis. As these muscles begin to work together again, the body can gradually regain better balance and reduce tension in the lower back. What makes this exercise especially suitable for people over 60 is that it's gentle and can be done comfortably while lying down. Many people say that after a few cycles of the movement, their lower back feels more relaxed and noticeably lighter. If you'd like to try it, start by lying on your back on a flat and comfortable surface. Bend your knees so your feet rest on the floor. Let your arms relax by your sides and take a few slow breaths to allow your body to settle. Next, gently bring your knees closer together. Place your hands on the outside of your knees and press very lightly inward. While your knees gently resist that pressure, hold this light effort for about *5 seconds *. There's no need to push hard. Then relax and take a breath. After that, place your hands between your knees and gently push your knees outward. While your knees again provide a small amount of resistance, hold for about *5 seconds. Then relax. These two movements form one cycle. You can repeat *6 to 8 cycles, moving slowly and breathing calmly. Small movements like these can sometimes create a surprising sense of balance and relief in the lower back and pelvis. There's no need to rush or push yourself. Simply move gently and listen to your body. For many people, Just a few minutes a day like this can help the lower back feel steadier, lighter, and more comfortable during everyday activities. Taking care of your health doesn't have to be complicated or overwhelming. Sometimes, just a few minutes each day to listen to your body and move gently can make a meaningful difference. Especially for people over 60. Spending just **5 minutes a day caring for the spine and lower back can help reduce stiffness, improve flexibility, and make everyday movements, like walking, standing up, or getting around, feel easier and more comfortable. If you tried even one of these exercises today, that's already a valuable step toward better health. There's no need to rush or do too much. The key is simply to stay consistent and move gently within your own comfort level. If you found this information helpful, please *tap like to support the channel, subscribe for more gentle exercises designed for older adults, and share this video with family or friends who may also be dealing with back pain. Sometimes, a small share from you can help someone discover a simple way to care for their health each day. Let's keep our bodies moving and growing stronger, one day at a time.